The study published last month in International Journal of Medical Informatics says iris identification was highly acceptable in both rural and urban areas. The testing done at Kenyatta National Hospital, Kiambu Level 5 Hospital, Kisumu East County Hospital, and Kombewa Sub-County Hospital in Western Kenya is in accordance with the U.S. President's emergency plan for AIDS relief, which demanded that Kenya move quickly and introduce unique patient identifiers for its HIV-funded projects. In January, a letter to U.S. Ambassador to Kenya, Kyle McCarter, PEPFAR Director Deborah Bucks set the use of such identifiers as a precondition for aid to Kenya. Failure to meet this requirement by financial year 2019-2020, the PEPFAR Director warned would result in reductions to the Kenya budget. The PEPFAR demand was mainly due to what it suggests as data manipulation in Kenya meant to project a bigger HIV epidemic and hence higher funding. To check on ghost clients and fraud, PEPFAR has recommended the immediate use of unique identifiers such as biometrics for all clients receiving its supported services. The study says, and I quote, "This indicates that the HIV program in Kenya may be ready for biometrics use for unique patient identification, a key priority for PEPFAR." The past efforts to introduce biometrics identifiers in HIV programs in Kenya have met strong opposition from civil society and human rights groups. The ministry, on the other hand, wanted a foolproof method of identifying individuals, especially those participating in HIV programs, for proper planning and accountability. The signing of the Data Protection Bill 2019 into law by President Uhuru Kenyatta last week has made it legal to collect, store, and use biometric data. The new law describes biometric data as personal data based on DNA, blood typing, fingerprinting, retinal scanning, or voice recognition. In the new study, the authors were impressed by the high acceptance of biometric data collection in both rural and urban Kenya, saying, and I quote, "Implementation of an iris recognition system in routine health information systems is feasible and highly acceptable as part of routine care in Kenya." Of the 8,794 patients who had been approached, the report says only 100 or 1% declined to be enrolled in the study. The testing was carried out by the Ministry of Health, Kenyatta National Hospital, and University of Washington in the U.S. Winnie Lubembe for Ebru TV.